Hey everyone, my name is Palomares and I'm a third-year medical student at Rush Medical College. I'm also a student member of the Immigrant Health Working Group at the Rush University Medical Center. Overall, the group's focus is on improvement in practice, structural policy, and operations aimed at making Rush health systems more immigrant-friendly. In 2019, I had the privilege of helping the group in assessing the knowledge of Rush physicians regarding undocumented healthcare policy. And just as some background, there are an estimated 455 to 513,000 undocumented individuals in the state of Illinois alone, many living within Chicago and its suburbs. And for the most part, these individuals are exempt from a lot of public insurance programs such as Medicaid and Medicare, although there are some exceptions. In addition to these exceptions, there are several free resources available to receive healthcare, such as federally qualified healthcare services, free and charitable clinics, as well as financial assistance at some nonprofit healthcare institutions. And although these resources may exist, many individuals lack the guidance needed to apply and receive these services. In addition to these structural and navigational barriers, undocumented immigrants also may experience fear in accessing healthcare, as well as facing providers who may not have had prior training working with this population. The fear that I mentioned is especially true now with everything that's been going on with COVID and with changes to public charge. In order to help Rush become more immigrant friendly, it must educate its physicians on how to provide a comprehensive and culturally competent care. By understanding where our physicians are regarding treatment of this population, the Immigrant Health Working Group and allies can work to create tools specifically tailored to where the knowledge gaps are within our institution. So in order to assess this level of knowledge, we surveyed multiple departments here at Rush, including emergency medicine, internal medicine, family medicine, pediatrics, and OB-GYN. And we did this using a 14-question anonymous survey of physicians within these departments. And in terms of our results, the survey ended up being completed by about 1/3 of each department that we surveyed. And overall knowledge levels were low to moderate, 64% of the physicians giving a correct response to a knowledge question, and a high percentage, around 29%, answering I don't know to those same knowledge questions. Although these figures are not in the poster, relatively few, around 29%, knew that undocumented adults, for the most part, are not eligible for state-funded insurance in most states, and as well as for federal funding. And only 30% of respondents were aware that primary care services were available at Rush satellite clinics to undocumented individuals. Overall, self-respondents reporting on a scale of 1 to 5 said that their knowledge of medical care options available to undocumented individuals was lower than their comfort level in advocating for undocumented patients to receive care at the medical center. And a very important finding in our last question on the survey was that only 8.2% of respondents could recollect having had previous training providing healthcare for the undocumented population. What was interesting is that that 8.2% that responded having had prior training scored higher on the knowledge questions and reported higher comfort levels with referrals for undocumented patients, as well as in advocating for undocumented patients to receive appropriate care. So in conclusion, to our knowledge, this was the first survey of its kind, and ultimately this study shows the need for more education for providers. While undocumented residents account for only 4% of the population, only 8% of those that responded to our survey had prior training on immigrant health. We believe that healthcare institutions should provide trainings to their providers on disparities in access to care that these patients encounter, as well as to understand at least some of the cultural issues that may impact healthcare inequities. Access for patients, regardless of immigration status, should be as standard as age-specific guidelines, vaccine adherence, or depression screening. And moving forward, the Immigrant Health Working Group is continuing to create educational modules for our healthcare teams. And most recently, the group has been working on creating modules for working with interpreters, as well as trainings for designated representatives in interactions with Immigration and Customs Enforcement. If you would like to contact us with questions or would like to get involved, please reach out to me or the chair of the Immigrant Health Working Group, Patrick Stanley, at the following emails. Thank you.